Good morning to all. Uh, Today my paper is on the topic Prevalence of Ophthalmic Disorders in Children with and Without Learning Disability, a comparative study. Vision plays a fundamental role in a child's cognitive, social, and educational development, and ophthalmic disorders during childhood can interfere with overall learning performance. So, this highlights the importance of early diagnosis and management of ocular disorders, especially in learning disability children. And few of the research studies have shown that children with learning disabilities have maybe an increased risk of ocular disorders than the normal children. Coming to the importance of the study, there are only limited number of studies based on this issue from our state. And aim was to determine the prevalence of ophthalmic disorders in children with learning disability and to compare with the prevalence of ophthalmic disorders in children without learning disability. Objective was to determine the ophthalmic disorders in children with learning disability. Second was to determine the ophthalmic disorders in normal children. And final was to compare the prevalence of ophthalmic disorders in children with learning disability with that of normal children. Coming to the methodology, it was a comparative analytical cross-section study done over a period of 18 months, February 2024 to August 2025, on children between 5 to 15 years of age on a pediatric ophthalmology clinic in CDC in a tertiary care center in Central Kerala. Coming to inclusion criteria of cases, children who was diagnosed as specific learning disability by clinical psychologist, and controls were selected as with no history of learning disability who are attending the school screening program. And coming to the exclusion criteria, it was children with hearing impairment and also parents who do not give willful consent for the study. According to the sample size equation, we derive a sample size of 60 with minimum in each group in case and controls a total of 30 and 30. And consecutive sampling method was used. And in study procedure, a proper informed consent from guardian was obtained. After that, detailed history taking regarding family history, birth history, and development history was done. A systematic ocular examination with emphasis on vision assessment till cycloplegic refraction and fundus examination was done. And dynamic retinoscopy was done using MEM method to assess accommodation anomalies in all children. And on PMT, after 3 days, we were assessing CVA screening also, along with Lia tools and Thathen's inventory type 2. And coming to the analysis, Fisher's X-ray test and chi-square test was used to assess the variable significance. Coming to the results, a total of 62 children participated in our study, that is 31 in learning disability children and 31 in normal children, and was an age-matched analysis with, as we see here, males made up a larger percentage in both categories in the study. And coming to family history analysis, the learning disability children had more occurrence of ophthalmic-related family history, and significant among one of them was refractive error in the family. And in normal children, there were less occurrence of family history, ophthalmic-related. And coming to birth history, the two study groups differed significantly. 80.6% of LD children and 9.7% of normal children had unfavorable birth history. And these were the statistically significant factors. There was preterm birth, low birth weight, neonatal resuscitation, respiratory distress during birth, prolonged NICU admissions, phototherapy, IVF treatment, and LSES. And these were the statistical non-significant factors. Coming to the developmental milestones, the two study groups differed significantly. That was, learning disability children had more abnormal developmental milestones than compared to normal children. And also, the LD children had 9.7% of history of inadequate immunization also. And coming to treatment history, there were more ophthalmic-related history was more pointing towards learning disability children compared to normal children. And these were my ocular findings. Most common one was the refractive error and followed by amblyopia. Then the most statistically significant ocular findings seen only in LD children was strabismus, and abnormal fundus findings were seen only in LD children, that was myelinated nerve fibers and temporal pallor of disc, and one child was diagnosed with CVI also. And coming to the refractive error analysis, most common refractive error was simple myopic astigmatism, which was mostly seen among normal children, and the final was simple hypermetropic astigmatism. And previous refractive error correction when compared to LD children, normal children was less, that was 11.76% compared to 31.58%. And second most common finding, amblyopia. Here, bilateral anisometropic amblyopia was the most common NIT. And in 10 LD children and 7 normal children were identified with amblyopia. Coming to the discussion, Here in our study, birth history was the most significant history from our study, and similar stomy perinatal history were encountered in referred study by like Gogate et al. Study and Kaleselvi et al. Study. And inadequate immunization in LD children was correlating with the similar observation in Eric Emerson et al. Study done in UK in 2019. And most common finding was refractive error, and similar findings were seen in other studies also. But second most common finding was different from other studies. And CVA was also identified in our study, and previous refractive error correction was more in our study compared to other studies. Coming to conclusion, majority of LD children had history of stormy perinatal period, and history of developmental delay and inadequate immunization were more in LD children. Prevalence of strabismus was significantly higher in LD children compared to normal children. Normal children had more occurrence of uncorrected refractive errors than LD group, and no significant difference in prevalence of disorders were present ophthalmic in two study groups. Coming to recommendations, children with perinatal complications should undergo LD screening and regular ophthalmological assessments. And also in normal children, we should give the importance of school screening programs, and also proper parental counseling regarding immunization should be stressed on. These are my references. Thank you.
What were the learning disabilities? What was diagnosed by the psychologist?
Ma'am, we separately diagnosed, sampled only specific learning disability children, ma'am. That was IQ more than 86 only we were taken for the study.
Yeah, IQ, nothing else apart from that.
IQ, Binet Camet method and NIMHANS battery assessment was done by the clinical psychologist, ma'am.
I think yes, using the term normal children is not fair. Okay, you can just term it as children without learning disabilities. Normal is a highly variable term.
Okay.
You're told about the sample size, no?
Yes.
Did you understand anything about that? Because you are given so much of formulas and all. No, I know you would want to calculate it also. But the problem is somebody with statistician might have given you.
Yes.
Did you ask him about explanations from for that formulas and all? Not interested. Please remember the examinations. Yeah, as an examiner, we will come and ask this question only. Definitely you get caught. Okay?
Yes.
That means just try to learn, at least for your recitation. Understand now? You're told about Erie-Bulfron, one case. Erie-Bulfron, no?
Yes, sir.
Did you examine that patient fully?
Yes, sir. I have examined the patient.
Did the patient had some syndromes? You know the name of this, as a PG, I'm asking you questions. Did you know the name of the syndrome for that Erie-Bulfron, sometimes associated? Lips problems and all. I've heard about it. No. At least know one thing called Kabuki syndrome. Kabuki, K-A-B-U-K-I. Kabuki syndromes is there associated with your Erie-Bulfron.
Yes, sir.
Okay. Just, of course, you are a PG only, no?
Yes, sir.
Nothing wrong. You just learn. Okay. Thank you.
Thanks.
That one rejoinder, caveat to what you said. You are saying like refractive errors and everything is more prevalent in the learning disability children. I think it's an illusion because probably learning disability children are more worked up by the ophthalmology team, and just because of that, it's revealing more errors. So the statement that learning disability has more refractive errors, I don't think is valid. And second, when you are comparing that group, then the next group shouldn't be normal children. It should be some other group which will come to check up. For example, you can say like every child which goes before preschool workup, preschool ophthalmic workup, like that, you limit the second group so that it becomes as close as possible to the first group. Only then they'll become apple oranges. Okay, so the normal children and learning disability children are poles apart, no? So that kind of checking cannot be done.
Thanks.